Hello viewers, welcome to Socialpost Health. Today we have Dr. Arshita Singh is with us, orthodontist from Dentaire Dental Clinic, having a 20 years of experience. Let's welcome her. Doctor, is having gaps between teeth, is it normal or does it always require a treatment?
Actually, in India, minor gaps between the front teeth is actually considered lucky.
That's true. It is considered that they are lucky.
So I'm not going to debate about that.
And they are going to be very rich in the future.
That's the general myth that people do have.
Okay.
So I'm not going to talk about that.
Okay. Not going to disappoint them?
No. So
Okay.
it's like as an orthodontist, from orthodontic perspective, it will depend on the age of the patient and the cause of the gap.
Okay.
If you see gaps in children, it is normal. In fact, it's even desirable.
Okay.
Because it's nature's way of guiding the bigger shaped permanent tooth into the position. The milk teeth are smaller, the permanent teeth are bigger. And if there is gap present between the milk teeth, it's easier for the permanent teeth to come into the right position.
Yes.
All right, so in that, it's even desirable. But for teens and for adults,
No, yeah.
it totally depends on the cause. If you have a gap that you see is increasing with age, that means you have some underlying periodontal issues.
Okay.
You need to get it checked. If you have a thick frenum that prevents your upper front teeth from closing, a frenum is a thick band of tissue between your upper front teeth that attaches your lip to the gums. Now, if it comes between the upper two teeth and attaches to the palate, that is the underside of your upper jaw, that needs to be cut and put in a proper position for the teeth, for the gap to close naturally. Then you have things like habits which cause the gap. If you correct the habit, you may not even end up with a gap.
Yeah.
Then there can be tooth size and jaw discrepancy. You have a bigger jaw, but you have small
Yes.
teeth. So you are going to end up with gaps.
Yes.
So there are a lot of causative factors, and each causative factor has to be understood and, if required, corrected.
I mean, how do you fix the gap? I mean, are you going to fill in something in that?
Few gaps, you just monitor them. If the patient is brushing well, flossing well, maintaining the gap well, they may not even need some correction.
Okay.
But if there is an underlying causative factor, gum diseases or jaw discrepancies, or if they are forming food traps, causing
Yes.
the underlying tissue, the bone tissue to resorb or be affected,
Yes.
or if it is because of some other issues like habits, they need to be corrected so that you don't end up with the gaps.
Yeah.
How do you correct them? Again, you can correct them orthodontically. You can correct them with aligners. You can correct them if they are minor gaps and you're conscious. You can get veneers done for them.
Okay.
Or you have varieties of treatments with which you can correct those gaps.
Yes.
But again, it depends totally on if it is actually required to correct it or
Yeah.
not.
And also Dr. Johnson has the same issue, right? But she got fixed. Are you aware of it?
The fans may like it, but it's on.
She actually explained it.
Yeah, it is on the patient's perspective. From patient's perspective as well, you have to see. And if the gap is increasing, you need to get it corrected. It, as I said, what is acceptable to the fans, they don't understand the physiology and the functionality of it.
Exactly.
A doctor and the patient knows what problems they are facing because of the gaps. So, if it is required, if it is functionally required, you have to get the gaps corrected.
She said that it's a medical emergency. I need to do
Yes.
this.
So it, as I said,
So it's true. Whatever you are saying is actually true.
So they may look good from fans' perspective, but they may not be very healthy for the patient to have.
Yes, doctor.
So it all depends on patient and the necessity of getting the tooth corrected.
True. Doctor, how serious are gum problems like a bleeding and pain in the gums, the swelling in the gums?
Yeah,
Do they need to take serious?
yeah, this is perhaps the most overlooked silent health crisis. As I've mentioned earlier, 95% of people in India suffer from periodontal problems, which includes bleeding gums. This is an early warning sign saying that you have infection in your gums. You need to get it treated before it progresses further, destroying your structural integrity of your teeth.
Okay.
The supporting structure of the tooth before they get destroyed,
But
before
it
the
looks completely normal, doctor, the gums. When they get bleed, if they check, they looks very normal to them. They
they
don't
it
find
may look
anything.
normal to them, but
Yeah.
a dentist is able to make out whether it is normal or not. Gums should not bleed. Normal healthy gums do not bleed.
Okay.
If you have bleeding gums, that means you have some issue. I'm not saying that it is only oral. In 90 to 95% of the cases, it is because of oral deposits below the gums. There can be systemic issues as well.
Okay.
There are other systemic problems which manifest itself first as bleeding gums,
Okay.
which is anemia, diabetes, vitamin C, vitamin K deficiency. You have
True.
cancers, wherein the first symptom is bleeding gums. In fact, in pregnancy also,
It's a warning sign.
yeah, pregnancy also, patients sometimes say, 3 months ago we got cleaning done, and now I'm like in my first or second or third trimester of pregnancy and I have bleeding gums. So that would warn us as to what is happening in pregnancy. There is hormonal disturbances that is happening,
Yeah.
and we are able to warn the patient so that they can communicate it well with their gynecologist and get the right treatment done. So in pregnancy also, the people face this, pregnant women face this bleeding gums issues. The main underlying thing is, if you have bleeding, it is not normal. Suppose you're brushing your hair and you find that while brushing you have bleeding on your scalp. Wouldn't you go to a doctor?
Yeah.
It's the same. While brushing you see that there is bleeding gums, you have to consult a dentist. Get it diagnosed, get it treated.
Just they will gargle, they will spit it out, and I'm good to
They
go.
think it's normal. They think,
Yes.
okay, while brushing, I must have brushed too hard.
Yes.
No, there may be deposits hiding below the gums that you're not even aware of.
Yes, doctor.
So it's better to get it checked, get it cleaned, and get healthy gums.
Yeah.
A healthy oral cavity or a healthy mouth is a gateway to a healthy body.
Yes, ma'am, that's true. Doctor, when procedures like root canal and fillings, tooth extractions, the tooth extractions, are they necessary?
These terms may appear very scary, root canals
Actually,
and
these
extractions.
do scare people.
Yes. But you have to understand that these are different stages of treating the same problem.
Okay, okay.
You have to understand that the tooth is into 3 layers. You have the hardest layer called enamel, followed by a very sensitive and softer dentine, followed by a pulp which is rich in blood supply and nerve supply. Now, if the cavity is happening in the first 2 layers, in the enamel and dentine, that's when we do fillings,
Okay.
which are tooth-colored fillings like composites or
Yes.
cements,
Cement.
wherein we remove the affected area and we fill it up. If the infection progresses further to the pulp, that's when you experience excruciating pain. It's a sign that your pulp is dying and it needs treatment. That's when we do the root canal treatment. We remove the infected area from your pulp, all the infected blood vessels and nerves, it's all removed. We fill it up with an inert material and give a crown. Because after root canal, the tooth is basically dead.
Okay.
It has no strength. Giving a crown on top of a root canal teeth gives it a longevity. It
Okay.
lasts more long. According to Indian Dental Association, if a root canal is done properly, then it has a success rate of 90 to 95%.
Okay. What do you mean by done properly? Doing properly? Is it also depends on the dentist or doing the procedure? How
It
it is?
depends not just on the dentist, it also depends on the maintenance after the procedure that you're doing. If you follow all the instructions, you should have a healthy root canal. The root canal will last long, but you need to follow the instructions that a dentist is
Yes,
giving. You have
yes.
to maintain the root canal treated tooth properly, floss, brush,
Brushing teeth and
get
all,
it checked
everything.
every year, because there are, as I said, the deposits form below the gums, which you cannot reach. A dentist is able to clean that. So, a root canal treated tooth can last for a long time, provided it is done accurately and if the maintenance by the patient is good.
Okay. After the root canal treatment, people must follow certain rules that given by the doctor, right?
Direction, yeah, not rules,
Okay.
but we do advise you to do.
Instructions.
Yeah, we do instruct you to do certain things certain way. If you do that, it should last long.
Okay.
The extraction is the last stage. When the tooth cannot be saved, when the infection has spread to the surrounding tissue, damaging the bone, when you have lost most of your crown structure because of the cavity, that's when we remove the tooth. If you cannot save the tooth in any way,
Okay.
the last resort is removal of the tooth. But here I also must say that if you are getting a tooth removed, please get it replaced.
Okay.
You
okay.
don't know the consequences of events that would happen if a missing tooth is not replaced.
What will happen, doctor, if they did not replace?
The side tooth, the tooths beside the extracted teeth, they may tilt. The upper tooth will supra erupt into that position.
Okay.
And now this has created an environment that is called as an improper bite. You're not chewing there very well. And because of the excessive pressure falling on the surrounding teeth, over time you may tend to lose them as well. So any extracted tooth should and must be replaced.
Okay. Where that fear comes from? For people, when they hear about root canal, they're all scared.
When you say root canal treatment, before giving you a root canal treatment, we do give you an injection. And there the fear comes from. You're
Okay.
injecting something, you're giving an injection in a person's mouth. That's how patients fear a root canal treatment.
Okay.
Plus the sounds of the machines.
Yeah.
Okay, you have a suction that is sucking out all the saliva and the blood and the things like that. The machines that are going around cutting your teeth and drilling in your tooth.
Not only children,
All of
even
that.
adults also
Adults are scared. There
for
are
the
men who are
dentist.
scared of injections.
Yes, doctor.
Apart from kids, even adult women are scared of injections.
Yes.
That is when they are seeing it happening on their body.
Exactly.
Now imagine the fear that they have when you're giving it inside your mouth.
True. True.
And few patients do experience pain during the root canal treatment. That also is associated with that.
Yes.
Because when the infection is too severe, the injections may not work.
Okay. Okay.
Okay? So to relieve the pressure that is happening, the pus that is present, we do start a root canal treatment and leave it.
Okay.
But till that, the patient is already under pain. So they attach that to the pain of the root
Okay,
canal.
okay.
And say that the root canal was extremely painful. It was already very...
But saving tooth is your first priority, right?
Saving the tooth is always our first priority. No matter in what way we can, we try to save the tooth.
Yeah.
If you do not have enough crown structure, we try to do something called as a post and core, where we put a small screw inside the tooth, take that screw support and replace the tooth. A natural tooth is always the best.
Yes.
Replacing it with artificial teeth, it should always be your last resort.
True.
Okay? But I can empathize with patients as well. When they have so much of pain, they want the pain to go away,
Yeah.
even if it requires removal of the tooth.
They don't care.
They don't care. But I must say that yes, it will give you relief, but saving that tooth should always be is always a dentist's
Yes.
priority. All the dentists try to save the tooth to the best of their ability.
Yeah, doctor. We believe. Doctor, how safe are the cosmetic dental treatments used to improve appearance of the teeth?
Any treatment suggested by the Dental Council of India is safe.
Okay.
No doctor will perform a treatment on a patient if it is unsafe. But yes, getting the treatment done on the right patient at the right time by a qualified dentist should be your priority. All right?
Okay.
People are into quick fixes nowadays. They see Instagram reel and they want a quick fix.
Yes.
That's not how it works. A dentist is the best person who will able to tell you or guide you to the treatment if it is required.
Okay.
Quick fixes do not work. You need to correct the underlying problems. You should actually need the required cosmetic treatment. If it is not required, no dentist is going to perform it. You should fall under the bracket of yes, the patient requires the cosmetic correction. That's why we are going to do it for them.
Okay.
All right. Teens, especially, we do not perform cosmetic treatments on them because they are still in their growth phase. Their jaws are developing, their teeth are developing, their face is developing. We do not perform, excessive cosmetic procedures on them. It should be required by the patient.
But people do consider smile correction comes under the cosmetic procedure.
Invisalign comes under the cosmetic procedure. But is it really?
Not true.
You require that treatment.
Yes,
That's when
yes.
it's being suggested to you. All right. But if a teen comes to me say we want veneers, we're not going to give them.
Yeah. And it also boosts their confidence, isn't it?
So correct the underlying cause. Get a braces. Get Invisalign done. Correct the underlying cause. If you have caps, get them closed. If you have crooked teeth, get it corrected. If you have jaw discrepancies, get proper orthodontic and surgical treatment done for that. Do not go for quick fixes.
Yeah. It won't
Okay?
fix the problem.
It's not going to fix the problem. You want a cosmetic treatment done? Then think about it in later stage, in your
Okay.
early adulthood, once your growth has completely stopped.
Okay.
And now you feel that you still need your cosmetic treatment done. Visit your dentist. If you fall under the bracket of needing it and you are the right candidate, dentists themselves will suggest it for you.
Yes.
There are treatments like bleaching.
Yeah.
Please do not do it yourself. Consult a doctor. They will tell you what is the right way to do a bleaching.
But some toothpaste are available in the market, right?
Yes.
They do themselves.
Yeah, but they are going to harm themselves more than it's going to be beneficial. Do it under the guidance of your doctor. Okay, then do it under the guidance of a dentist. They will guide you in a better way to do it. So these kind of procedures that you think it will beautify my smile. Yes, maybe, but it may also cause you harm. You don't know what you're doing.
Yes, true.
So consult a doctor. Do it under the guidance of a doctor.
But they are advertising it, right?
Have you ever seen a teen being in these ads?
No.
You see adults.
Yes.
All right. And even in adults, I'm not nothing against the advertising agency or I'm nothing against the corporates, but even they will not suggest you not to consult a dentist first.
Yeah. Yes.
Okay. Do it under the guidance of the dentist. Dentists themselves will suggest, okay, now you go for
Yeah,
this.
that's
This
true.
is how you are supposed to do it. This is how you're going to safely correct the color of your teeth. So please consult a dentist and do it under the guidance of a dentist.
What daily habits can gradually damage our teeth?
Dental problems do not develop overnight. It takes time for the problems to show.
I agree.
All right. So when you say about daily habits, you have to do it every day, or you have to do it very frequently for it to show any problem. The most frequent one is frequent snacking.
Okay.
All right. You keep snacking on stuff when you're free, when you like a certain type of snack. These frequent snacking over time causes dental problems. But if you do frequent snacking, but clean your mouth after.
Thank you, doctor. Thank you so much.
Thank
for
you so
your
much for having
time
me.
and your information.
Thank you so much.
Thank you.